Okay, hi everyone. So in this video, we're going to be looking at auscultation. Obviously, as you all know, auscultation is listening to the heart um, with a stethoscope, and you're trying to pick up different pieces of information. Um, so in this video, I'm just going to be talking about where you would listen with the stethoscope. So you can listen in four different regions, and those correspond to the four chambers of the heart. So you can listen to the mitral region, the tricuspid region, the aortic region, as well as the pulmonary region. And each of those places have particular landmarks where you're most likely to hear that particular region. So, for example, the mitral region, you can see one, two, three, four, fifth in the intercostal space, uh, mid-clavicular line usually, and then the tricuspid, which is the either the third or the fourth intercostal space, right sternal border, aortic, second intercostal space, right sternal border, and the pulmonary on the other side, second intercostal space, left sternal border. So those are the four regions of the heart that you're going to be listening to. Now, you would have noticed on your stethoscope, you've got a diaphragm and you've got a bell. And all the regions of the heart, you will use the diaphragm. And with the mitral valve, you will use the diaphragm and the bell. And the reason for that is because the bell of the diaphragm, they describe it as a resonating chamber, which is very good at amplifying very low pitched sounds. And we know that some of the pathologies that occur in the mitral valve are quite low pitched. So, for example, if you had a mitral stenosis, that would allow you to pick that up very quickly. But the Talionaconda does mention that when you apply the bell to the mitral valve, you mustn't be very forceful. You should actually put it very lightly over the chest, because if you push too hard, you're actually making the bell a diaphragm. So very important technique-wise when you're using the bell to push lightly.